Welcome to another segment of Around the Conference, a weekly program to share news and information from the Seventh-day Adventist Church in the Southern Bahamas. I am Barrington Brennan, sitting in for Pastor Paul Scavala, our host. Today we have special guests visiting us here at Around the Conference, and I'd like to introduce them first, Dr. John Carey, a retired Seventh-day Adventist minister, person very active in the community in many areas, and you'll find out one of them in a minute. And then Dr. Ann Roll. And we do have another guest, Dr. Swain, coming up later on. Dr. Swan coming up later on. But Dr. Carey, welcome, and Dr. Ann Roll, welcome to Around the Conference. We're delighted to have you here today.
Thank you.
And you're here to share on a very important life-changing program that has been going on for a little while. And it's coming up, a new event of it, or a new program of it is coming up in a few weeks.
That's right.
Dr. Carey, what is that program? What is it called?
The program is called Breathe Free 2.
Breathe Free.
Breathe Free 2. A
Like,
plan to stop smoking.
like Breathe Free.
That's right. That's
okay.
right.
And what is it all about?
The Breathe Free program is an effective smoking cessation program that's been in vogue for a number of years, in fact, over 50 years. It's divided into 6 segments or phases. Phase 1 is the preparation phase, where you have sessions 1 and 2, preparing the person to quit smoking. Mm-hmm. And phase 2 is the celebration phase, that's session 3, when the person decides to quit smoking, and he's backed up by all his friends and those in the program. Phase 3, detoxification, that's when the body is being flushed out of all the nicotine and other harmful substances from the cigarette smoking. And then phase 4 is the normalization phase. That's when the body is getting back to its normal self, free of tobacco and nicotine, whatever else in the system. And phase 5 is the graduation phase, and that is when the person celebrate their victory over cigarette and smoking. And phase 6 is what we call the stabilization phase. That's after the program, when the person's out into a regular community now, and they're living a smoke-free life.
Okay. Well, I'm glad you shared that up front here. But let's take the time to introduce our guest with you, Dr. Carey. Could you introduce this dear lady, please?
Yes, I'm pleased to be associated with Dr. Ann Roll, who is a nutritionist. She's worked in that area for a number of years, but now retired, but still working.
Okay.
And helping in many ways. She currently is the lead person for the tobacco cessation segment of our Healthy Bahamas Coalition program.
Okay. Is the Healthy Bahamas Coalition program a part of the national government initiative, or is it a private initiative?
Dr. Roll, you want to?
Dr. Roll?
It's part of the government initiative, and Dr. Swan is going to say a whole lot about it when he comes on.
Okay.
But we are part of the whole ensemble with several subcommittees, and the tobacco cessation control is just one of them, of the many. But Dr. Swan is going to elaborate on the HBC, Healthy Bahamas Coalition, and its role and function.
Could you go back to you, Dr. Carey? You said something at the very beginning about a long time, 50 years, and I could remember something. So what was the initial program called that is now called Breathe Free?
Yeah, in 1959, one Dr. McFarlane and Pastor Falkenberg created a unique smoking cessation program called the 5-Day Plan to Stop Smoking. And this plan was improved after a number of years in use. And in the 1980s, it was renamed the Breathe Free Plan to Stop Smoking. In 1988, the Center for Health Promotion at Loma Linda University evaluated this program and made some additional revisions. And it was field tested in 1991. Then in 2012, the General Conference, Health Department, and the International Commission for the Prevention of Alcohol and Drug Dependency commissioned Dr. Handysides to revise and update the program. And as a result of this revision, we have the Breathe Free 2 program.
Okay, now the first program was 5 days.
5 days.
So how long is this program?
This program goes for up to 6 weeks.
Okay.
5 to 6 weeks.
Okay.
And of course, it's 2 days per week.
2 days per week for 6 weeks.
2 hours per day.
Okay. The 5-day plan to stop smoking is now Breathe Free 2,
yes.
and it covers a longer period of 6 weeks, 2 days a week
Right.
to help individuals stop smoking.
Yes.
Okay, so who else will be helping in this program? And
Last year, we trained a number of about 38 persons, counselors, who volunteered to assist with the program. So during this initial program, we'll have about 5 to 6 of them assisting us.
Okay, so then here's the punchline. Why are we having this program? You know, at this time, is smoking a problem in the Bahamas?
We're having it at this time to support the World Health No Tobacco Day, which is the 31st of May. Additionally, the World Health Organization has been requesting all governments do more to rid their countries of the smoking problem.
Okay.
And this is part of that emphasis, because smoking has been a real burden to many countries, financially, socially, and otherwise. And whatever can be done to eliminate this problem ought to be done in order to help our citizens live more healthy and happier lives.
Well, comparatively speaking, how would you say the Bahamas would rate, or where would you fall in terms of smoking compared to maybe some sister nations in the Caribbean or other nations around the world? Where do we fall?
I think we're similar to the other similar Caribbean nation. In fact, third world countries, you find that smoking is more deleterious in the third world countries than some of the other advanced developed countries.
Okay.
Yeah.
Having just traveled from France and Europe, they smoke.
Yes.
They smoke. And England,
do.
they smoke. And Asians, they smoke. I always say, although we have a serious problem here, we don't smoke, we drink, we smoke, compared to others. But it's serious. We've been doing this for many years, Dr. Carey, and now we are reaching another level to help more people stop smoking. And I understand that there are some myths about smoking.
Yes.
And,
yes.
Tell us about that. What are these myths? And Dr. Anrol, you're free to expose some of them.
Certainly, yes.
Yes, there are a number of myths that have been noised around about smoking.
Okay.
You'll find that smokers use these myths as crutches to avoid quitting. Some of them are, I've been smoking for so long, there's no point in my stopping now. Another is, I'm not addicted to nicotine. I use it, but I'm not addicted to it. Another, smoking keeps me thin. I don't want to get fat, so I smoke so that I can remain thin. And another, my smoking only harms me. And this is one that really concerns a lot of us.
Concerns
because
me too.
Smoking affects everybody in the environment. We refer to it as secondhand smoke, which is very, very damaging to those persons in the environment, particularly children and mothers, pregnant mothers. So it ought to be a concern of every well-thinking person who has love for anybody around him, connected with him. He ought to be considerate and try to save himself by quitting and to help those around him not be adversely affected.
So then, being a part of this program, what will be the main benefits of the program having completed it? this Breathe Free 2 program?
There are three major benefits: health benefits, economic benefits, and social benefit. As far as the health benefit goes, there will be less risk of cancer, less risk of heart disease, less risk of emphysema, less risk of stroke. There will be increased energy, greater sense of well-being. The economic, there'll be more money available to spend, because a lot is spent on cigarettes. There'll be less sickness, less medical expense. If folk are not sick, you won't have to pay the medical expense. And there will be less damage to possessions. A lot of folk have lost property by smoke.
Yes.
Some even had their houses burned down by carelessly using the cigarette. And of course, social benefit, there will be improved skin, improved teeth, and improved fingers.
And improved
you
breath.
watch a smoker's fingers. Then there'll be fresher smelling breath. And of course, possession, because the smoke gets into the fabric, the clothing, the furnishing, whatever. And of course, there'll be more self-confidence and influence with others.
Now, go with that, because what we have to do, we haven't shared where they're coming, dates and all that. We won't get that in before the break, but go ahead.
Okay,
Dr. Roll.
I just wanted to add that the family would be healthier too.
Oh, yes.
When
That's
you
right.
look at the children and the impact of smoking, secondhand smoke on kids in the household. So you'd have a lot less illnesses, especially the respiratory issues with the family, and you'd have a healthier, happier family.
Okay, so we're here to talk about Breathe Free 2. It's at a specific event also that will be taking place when, Dr. Carey, Dr. Roll?
It's on the 28th of May to the 25th of June.
What day of the week is the 28th?
Monday.
Monday. So it's from Monday, the
On a
28th of
Thursday.
May.
And then Thursday,
It's for 6 weeks, you said earlier.
5 to 6 weeks, depending on the situation.
Every 2 days, 2 days a week.
2 days per week.
Okay. At
Every
what time of the
Monday
day?
From 6 to 8 in the evening.
And where?
It'll be at the H.D. Colburn Gymnatorium on Wolf Road. That's the old Bahamas Academy site, just opposite Bamboo Shack.
Yes,
Everybody
west
remember
of AID.
Yes, yes.
Okay,
yes.
that way where it will be, and you'll be there, and you'll be there.
We'll be
Yes.
there.
And you want many smokers to come
As
who
many.
want to free for themselves from smoking.
Many
What's the
who would like
cost?
to quit.
What's the cost?
Interestingly enough, this is a community project, so it's free to the community participants, and it's funded by our sponsor, the South Bahamas Conference.
Of Seventh Adventists?
Yes.
Okay. Thank you for sharing that, Dr. Carey. Let's return in a minute after the break.
We are people, and we love to get connected. We connect as families because of birth. We connect as friends because we click. And we connect as communities because we care. Seventh-day Adventists are people who connect in communities called congregations, which in turn connect to form conferences, who connect together to form unions, divisions, and the General Conference. Why do we connect? It starts with a connection to the Creator, who invites us on a spiritual journey. When we journey together, we can help each other along the way. This journey is a journey of a lifetime, and as we learn and grow, life becomes filled with meaning and purpose. Our greatest joy is in helping others along the way. Wherever you are on your journey, we believe that we have something to offer that can make your life more whole. So the next time you see a Seventh-day Adventist, remember, you're not looking at someone who stands alone. They are connected to a world church that has 18 million members, gathered in 13 divisions, comprised of 122 unions, formed by 600 conferences, serving in 140,000 congregations in 208 countries, who worship in 924 languages, and they all want to connect with you.
Welcome back. This is Around the Conference, and we're delighted to have you watching us today in this special program about smoking or stop smoking, breathe free too. In this segment, we have another guest, Dr. Phillip Swan. Welcome, sir, to Around the Conference here in the South Bahamas Conference of Seventh Adventist Media Department, and which is viewed every week on our television 658. Dr. Swan, tell us briefly, who are you and where do you work?
Well, thank you, Dr. Brennan, for having me. I am a medical doctor with a background in public health or population health. Presently, I work at the Ministry of Health with some responsibility for national programs. And in my role here today, I'm the chairman of the Healthy Bahamas Coalition.
The Healthy Bahamas Coalition. Now, you brought that in. What does that mean?
So the Healthy Bahamas Coalition is a group of about 50 to 60 private sector, government, faith-based organizations, as well as civil society groupings that basically have come together to determine that we need to raise the awareness of the risk associated with non-communicable diseases. We are the National Non-Communicable Disease Commission for the Bahamas, and our role basically is to raise the awareness, as I mentioned earlier, about the risks associated with hypertension, diabetes, cancer, obesity, violence, mental health, all of those contributing factors to your non-communicable diseases.
Okay, thank you so much. So we're talking today about Breathe Free program, and which will be coming up shortly, May 28th, at the Bahamas Academy at the H.D. Golden Gymnasium, Wolf Road. Yes. Now, we shared earlier about myths. I'd like to start with you, Dr. Rold, to what are some of the side effects of cigarette smoking? And should I add, when you say cigarette, are we talking about BDs and talking about cigar and talking about any smoking? Go ahead, madam.
Well, we know that smoking is a very high risk to the country, to anyone, and it's dangerous. And when we talk about the side effects, it spans a whole load of, taking a lot of other things apart from just the smoke, because the theme actually for World No Tobacco Day is tobacco and heart disease this year for 2018. So we try to raise awareness to the plight of tobacco and heart disease and the other diseases, because tobacco is one of the highest risk factor for those chronic diseases that were mentioned, like diabetes, cancer, heart disease, and respiratory diseases. Okay. And because of that, those diseases and smoking, it sort of just goes off to the roof. More and more deaths. You have thousands of deaths per year related to tobacco, smoking, and those diseases. So some of the risk factors we're looking at is trying to assist people to be aware, raise, as Dr. Swan said, raise awareness. Because we know for 30%, you have a 30% chance of having a heart attack when you're smoking, and like 25% with a stroke. Women, and it's popular now, some of the young women are smoking, and especially on contraceptive, they have 30% of having heart attack or stroke. The children are affected in the household because you have respiratory infections, you have asthma. There's a whole host of other issues that could be affected when you're a smoker, and the impact on your family or your surroundings or your environment.
Okay. And Dr. Swain, would you like to expand more on some of the side effects of smoking?
Well, I think that Dr. Roll basically covered the main ones. We have the concentration on this year's World No Tobacco Day is, as you said, on tobacco and heart disease and cardiovascular diseases, which are your strokes. And the data around the world shows that tobacco is the second most detrimental contributor to heart attacks and strokes behind hypertension, high blood pressure. So in the Bahamas, even though we don't have a high rate of use, you have about 7% of the population, according to our survey done last year, use tobacco.
7%?
7% use tobacco across the board. I mean, of course, 10% of males between the age of 15 and 65 use tobacco, at least 10%. And so the reality is, we are trying to reduce the number of deaths, premature deaths associated with cardiovascular disease, which is a non-communicable disease. And as we tackle on one side early diagnosis of hypertension, proper treatment of hypertension, we also want to tackle the other smaller hanging fruits, and that would be that of now tobacco smoking. And so there's some things that the government has done, and what just happens to be one of them through the Healthy Bahamas Coalition and working with Dr. Carey and now the Bahamas Seventh-day Adventist Southern Conference, and trying to offer services for persons who may have a problem with tobacco use, especially cigarette smoking, giving them this free opportunity to get access to these services.
Okay, just one question that you can answer around a bit, because you said stop smoking.
Correct.
The emphasis is on tobacco. How do you relate this to other kinds of smoking, marijuana smoking? And I know this is tobacco smoking, but do we have similar illnesses? Although we can have that for another program, but when people say, oh, they're not talking about tobacco, about marijuana smoking, they're talking about tobacco. But is there a correlation, or there is a connection in terms of some of the illnesses you're referring to?
So tobacco smoking is specifically related to these conditions that we spoke to. One of the challenges of tobacco smoking is that it's known as a gateway drug or gateway habit, nicotine. So it leads to you persons going on to smoking marijuana, using cocaine and other more illicit drugs. So the idea is to try to prevent persons from getting on that train towards the illicit drugs.
Okay. Well, thank you so much for sharing that, and we look forward to that program that's coming up. And let's put a plug there again, because we're going to go on to something else. Dr. Roll, when will be the special event, please?
It starts on May 28th.
Monday,
May 28th.
Okay.
Hopefully we'll have some flyers out soon. It's 2 hours on Mondays and Thursdays.
At what time in the evening?
6 p.m. to 8 p.m.
Okay.
So it's after work, so you can at least be available.
And it's free?
It's free, and those who are struggling with smoking and looking for healthy outlets, a healthy way to get some support, because it'll be a very supportive program. We had facilitators trained just for that, to assist people who really want to smoke. And as Dr. Swan said, it's part of our helping to reduce the burden of those diseases, because tobacco is preventable. And it's one of the most deadly.
Till you stop.
Yes, but this is where the help comes in.
Well, so we look forward for you coming to the H.D. Colburn Gymatorium, Wilf Road, Monday, May 28th, for 5 to 6 weeks, 2 times a week, Monday and Thursday. It's free. So if you smoke, or you know someone else that smokes, come out to that program. So now let's go forward. As would you like to share anything about Breathe Free as we go on to the Health Bahamas Coalition program of the Bahamas? Anything you want to say about Breathe Free before we go on to that?
Well, the Breathe Free program is a program aimed to assist persons to stop smoking, and it's different sections, as Dr. Carey elaborated on earlier. We have different sections, and as a result of going through the program, hopefully you would be more inclined to stop smoking, and there's a support system in place afterwards.
Okay,
so
that's
which
important.
is yes, it's important, because up to about a year you would be there'll be follow-up sessions.
Okay.
So like you tend to relapse.
Okay.
There's always going to be someone there you can call on to have some support.
Okay, so you're not going to give up on them once that's over. You're going to follow up, and that's important.
Right.
Follow through.
And we're asking family members also to support that person, because it's important that they have the support from the home as well.
Okay, beautiful. So now the Healthy Bahamas Coalition, Dr. Swan. Tell us more about it.
Well, we are made up of about 12 subcommittees, of which tobacco cessation and control is one of them. We also have an alcohol consumption reduction. We have child and adolescent health, mental health, grouping, violence and injury prevention, nutrition, physical activity for all ages. I think that covers cancer awareness and hypertension, diabetes,
The elderly.
and promotions, older persons'
Education awareness program by?
Right, basically it's basically trying to target all of these main veins of these non-communicable diseases.
And how can we get involved? We, meaning those who are viewing, you and I, who are not a part of it. What can we do to support, be involved in
we have
HBC?
Right, so the Healthy Bahamas Coalition, we have quarterly meetings that we invite all of our members to be a part of. As you see, the third Thursday in the quarter, the second month in the quarter, and we just had one last week. But you can go on our website. It's at healthybahamascoalition.com.
Healthybahamascoalition.com.
We also have a Facebook page that you can also go on to and get some messages, continuing messages about what it is that we're doing.
Okay.
And you can also be a part of any one of our 12 subcommittees. There's no fee to join.
Yes, that's exciting. I'd like to be a part of that. So now, that brings us down to this final point. Let's talk about World Tobacco Day, I think it is. What is that? When is that coming up?
Yeah, World Tobacco Day is
it's World No Tobacco Day.
No Tobacco Day.
World No Tobacco Day.
Yes.
That's a good point.
Yes,
right. Not World Tobacco Day.
Right.
We got it. Mm-hmm.
So we are advocating, as I said, the theme is tobacco and heart disease. We're trying to raise awareness and getting different groups and organizations to be more aware and give some talks, put some tips out. And the focus was, initially it was started by the WHO along with other entities to raise awareness to the plight of tobacco disease and the diseases, the widespread damage of tobacco in the world. So the campaign is to educate and at the same time work with governments and other agencies to help to bring more education and awareness to more people, because we find in some of the countries they're not aware of the dangers. So World Tobacco Day is that day on the 31st of May every year. It's set aside for that particular purpose, to raise awareness, educate, and make people more concerned about the dangers of tobacco.
Yes. Mm-hmm. How long that has been going on by the World Health Organization? Many years.
Yeah, many years.
Because I asked that because many of us haven't heard about it.
Right.
Yes.
And I think we need to do more to promote this. We're happy in the Bahamas that we may not be bad as other nations, but we're still bad. Once we have 7% of the population smoking, and you only need 2 at the door to cause you to get sick.
Exactly.
So we thank you for coming, Dr. Carey, Dr. Swan, and Dr. Roll, for promoting this event that will begin at the Bahamas Academy, Old Bahamas Academy. Now let's get that straight. HD Colburn Gymatorium, Wolf Road. That will be the Breathe Free 2 program beginning Monday, May 28th.
At 6 p.m.
At 6 p.m. for 2 times a week, Monday and Thursdays, and it's free. So if you want to stop smoking, plan to be there.
Correct.
It's free. Okay. You have one more little thing to say, madam?
Yes, a contact number, because people need to know.
A contact number.
Correct.
It's 557
557
2037.
557 2037. That's a number they can call right now or sometime to ask more about registering for that. 557 2037. 557 2037. So we thank you so much for coming and sharing us on Around the Conference here at our media department, the South Bahamas Conference. And you have been watching Around the Conference, a weekly program by the media department of the South Bahamas Conference of Seventh-day Adventists. I'm Barrington Brennan, sitting in for Pastor Paul Scavala, our host. Next week we'll have an exciting new program for you. Goodbye, and may God bless you.